Thanks for being with us once again on our live streams, a continuation of the last week. I'm not going to go back and cover all of last week, but we talked about anxiety leading to depression and how there's kind of a continuation or common themes. We also talked about adrenal stress disorders and how the demands of life, working 2 jobs, moms working, trying to keep a home, a lot of stress. We just battle lots of stress. But didn't folks during the Depression battle? They sure did. They absolutely did. Didn't our parents and grandparents battle stress? Didn't they battle stress hundreds of years ago? No doubt about it. We live in a different time and age. Multiple sensory input, just overwhelmed. We're many times just overwhelmed with the demands of our lives in many cases. So I don't want to get too distracted here. I want to thank you, first of all, for being with us. These live streams are important to us. I believe they help and hopefully bless you. They're points of contact, points of information, and education. And we're going to continue to do them. We have to continue to find topics. We have not been at a loss for topics to date. If you have suggestions on topics, I would encourage you to send us an email at support@askjoedimatteo.com. And we would like to be able to help you with as many different areas as we possibly can, or whatever, Lord willing, my skill set is. So today, a continuation of stress, high adrenal output, and how that leads to anxiety, how that then couples over to depression. And so I want to tie all these together, but the focus today will be more on depression because we kind of covered to some degree, and I don't think my marker's writing, we kind of covered to some degree the whole anxiety portion of the anxiety aspect last week. Today I want to focus a little bit more on depression and how we get there. Now I'm going to read you during the course of this today, somewhat different than I've done in the past, but I have a lot of articles in this regard. And I'm going to talk to you maybe at least initially about maybe some meds and some medications that are used to treat. Maybe not. I'm going to hold them. I will hold them. But just a couple of quick thoughts here. I don't like doing this and reading while I'm talking to you, but burned out, more likely to get medication. A Finnish study a few years back said that those that suffered and felt like they were burned out were more likely to receive medications, especially antidepressants for mental health problems. Researchers at the Finnish Institute of Occupational Health, 3,200 Finnish employees. Journal of Occupational Environmental Medicine looked at them. 26% suffered symptoms of burnout, with another, I can't read this printing here, suffered another 24%. So about 25%, 26% symptoms of burnout, another additional 25% severe burnout. Over 50% of the 3,200 employees that they interview, they sit down, do questionnaires, interact with them, say, I just feel burned out. Now, here's the problem with that. That goes back to my adrenal process, saying that for many of you with anxiety disorders, panic disorders, depression, it is rooted in being literally adrenally burned out or excessive adrenal output, high cortisol, etc. Go back and view the last video. High antidepressant prescription rates raise the possibility that in some cases the symptoms of burnout have been misinterpreted as a mental disorder requiring medications and having patients being treated with psychotropics, antidepressants, and I'll just throw in here a lot of or anxiolytics, anti-anxiety meds. Bipolar depression not helped by antidepressants. The mood swings from depression to mania that afflict many with bipolar disorder can be tempered by drugs such as lithium. But adding antidepressants to ease the depression aspect, not helpful. New England Journal of Medicine back in 2007. About 1 in 10 U.S. teens now face major depression. Nearly 1 in 10 American teenagers, this was as of about 5 years ago. It's higher than that right now. Major depression last year, fewer than half were treated. They believe that overall about 10% into about 2.5 to 3 million of U.S. teens suffer from some form of depression. This is huge. So those are just and I just pulled a smattering I've got tons of literature. I put a couple of the folders over there to kind of back up my points. But the real key is burnout, anxiety, excessive adrenal output, the demands on our life. I'm overwhelmed. I'm overworked, 2 jobs, or working full time, taking care of a home. I have children. I'm trying to get to games. I'm trying to go to school. We're overwhelmed. There's no doubt about it. That leads to excessive adrenal output. That begins to burn the neurons, singe the neurons. We lose connectivity. We don't eat as well. So today, don't want to focus on all the downsides. We want to focus, necessarily more on the upsides and how we can help you. So we're going to talk about everything from how a better aspect to understand how stress plays into this, why exercise can actually be as effective as antidepressant medications. We're going to talk about how a poor diet certainly is involved here, and that might be our next aspect. The other area is inflammation. Now, I'm not talking about the old version of rheumatism, as many of you are familiar with, but inflammation because of a bad diet, a lot of wrong fats, too many whites and refines, and we don't have enough quality fats, good fats. Many young people kind of going through some crazy dietary areas restrict their fats. We need fats. We just need quality fats. And we will teach you how, back up here, how it even affects cell membranes. But inflammation, and again, this is not so much the way I like to do these things, but I want to just quote from this. Major depression is accompanied, this comes out of Neuroendocrinology newsletter in 1999. Major depression is accompanied by various direct and indirect indicators of moderate activation of the inflammatory response system, increased production of pro-inflammatory cytokines, that's pro-inflammatory proteins, such as interleukin-1, interleukin-6, and interferon gamma play a crucial role, acute immune response to depression. So in other words, they're saying here that this can be actually in response to depression. What we also see, and we have literature pieces that say that actually chronic inflammation because of bad fats in the diet, not enough good fats, a poor diet, begin to change the membrane, the neurons in the brain that lead to and can actually propagate depression. Mental illness, depression, anxiety, stress. Now, I'm back to here. I kind of feel like I'm all over the board, but you stay with me. Mental illness, depression, anxiety, and stress. Notice how they tied them all together. This is a research piece that appears in the European Journal of Clinical Nutrition, 2007. A prospective trial looking at 7,900 individuals. Results indicate that omega-3 fatty acids, polyunsaturated fats, consumption of fish lower, now watch this, the risk of mental disorders of depression, anxiety, stress. Everything I talked about last week. So we pulled in that stress plays into anxiety, plays into depression. You following me? So why did I talk to you? And I forgot to bring some, excuse me for 1 second. Don't mind me. Why we talked about adrenal essentials last week. Why I have a couple different nutrients placed up here, the omegas, adrenal essentials, mood essentials rather, some L5-HTP, St. John. Do I want you to take all of these for your mood? No, but I need to have you aware why I feel that balancing the adrenal response and the stress response is critical to your health, simply because when I have high output, as you can see here, even in medical journals and journal research, they put all three of them, that triplicate process, stress, anxiety, depression, quote, mental illness, they wrap them all into one. Basically, the authors conclude there's a beneficial effect of omega-3 polyunsaturated fatty acids on total mental disorders. On total mental disorders. So notice they put and classify stress, anxiety, depression. They just lump them all in there and say mental disorders. Now, I don't want to get into if you're a psychiatrist or a psychologist. I don't want to get into the details of that. I mean, just the overview is there's some strong links here. And we want to be able to help you that if you have tendencies towards depression or you have family members towards depression, in these snippets of 45 minutes, I certainly can't cover every single aspect. We're going to cover as much as we possibly can. Some of the downsides of meds. I kind of do want to go here for a few moments. Some of the downsides of medication. And I had pulled a couple other issues, so let me just talk about that. I kind of wanted to hold that till later, but I don't think so. I think we'll do this now, and then we're going to come back to what methylation means. Don't be frightened by some of this terminology. It's pretty simple. I'll explain it. What methylation means, what cell membrane activity or balance really means, how do you modify inflammation, and then this is up to you, the diet and exercise activity portion of it. Stress, we all have it. And we can't always all deal with it, and we can't deal with it always effectively. But we need to be aware that stress impacts and plays into all of this area. And then why eventually we want to evaluate things like neurotransmitters, and also to do, as mentioned in the previous teaching, adrenal stress indexes. Why? Because if I've got exploding cortisol response, exploding DHEA drops, I've got this huge, overwhelming stress response. I am altering and changing the neurons in the brain, which impair uptake of neurotransmitters and communication. So literally, you've got these neurons, and these are called synaptic clefts, and high levels of distress begin to melt these neurons, begin to damage these neurons. These neurons then are not able to release and communicate. There's poor communication. Cell membrane fluidity is damaged, so I'm not transmitting norepinephrine as efficiently, serotonin, dopamine, etc. These brain chemical messengers, and also the uptake. So I'm not transmitting. The uptake is impaired. Now, when I throw in stress and a bad diet, this is a cocktail for destruction, honestly and truly. And I don't know how else to frame this, but we're in a bad way in our society. As of 7 years ago, 1 in 7 teens depressed. Now, that's a huge problem. We see housewives. I have an article here on housewives. How many housewives, and I'll quote that in a minute, under depression, anxiety states, on multiple medications, Paxils, Celexas. And again, let me just state that it's not that, I'm here to banter against medications. It's not. My background is in pharmacology. That's not what this is all about. This is to teach you so that you're aware. I always say buyer beware, user beware, so that you're aware of what some of the downsides are, and really then what you want to do to try to enhance your prospects going forward. So let's just talk a little bit about what I believe are some of the downsides of medications, antidepressants, etc. This comes from, not real sure what journal. It actually was researchers at Mayo Clinic. It was printed in a sleep disorder journal, but just listen. Sleep disorder characterized by violent dreams, often acted out while sleeping, may be more common in people taking antidepressant. REM, sleep behavior disorder, RBD, typically present in patients in their 50s. Wow, that's me, Joe. Maybe I'm exhibiting some sleep behavior disorders. The doctor's noticing a trend more frequent in the 30-something population, okay? So it's moved down from the 50-somethings, these violent dreams, acted out while sleeping. They're moving from the 50s into the 30s, and guess what the common link was? Those that were taking the antidepressants. Not that it's just trickling its way down in age groupings, but it's ones that were using meds. REM sleep, the muscles are paralyzed, but antidepressants, watch this, may affect the neurotransmitters that keep muscles paralyzed. Our findings suggest that RBD, which is REM sleep behavior disorders, in younger patients in their 30s, instead of the usual ages, maybe into the 50s, is frequently linked to antidepressant use. A sleep medicine specialist, Dr. Robert Auger at Mayo Clinic. He says that we're looking at aspects of what we call folks can say there are multiple interpretations, but we're saying that there's a link directly to antidepressants. I'd interpret this to mean one of three things. In younger patients, antidepressants can cause this. In younger patients, RBD results in a psychiatric diagnosis, or it's a common factor. Bottom line is, which in turn results maybe in antidepressant medications, but the real key is what they find, and they see it more in folks using multiple medications. So let's just talk about meds for antidepressant, and I'm not going to get too much into the anti-anxieties things. We covered anxiety, but just a couple quick points. Infants born to moms that were using SSRIs, we already know that there's a higher rate of heart valve and valve disorders in children that were born to moms using antidepressants. But watch this. The first 4 days of life, moms that were on SSRIs, the children, the infants, exhibit high incidence of tremor, restlessness, and rigidity. They have a lot of literally neuromuscular manifestations and tremor. We also see that clinical studies show, now this is important, that drugs that modify the serotonin pathways in the brain, drugs like Prozac, Celexa, Zoloft, that was documented at least in these three meds, that there's a corresponding drop in dopamine. So that as the meds are causing a rise, not in the manufacture of serotonin, but as we call them reuptake inhibitors, that it's pushing the serotonin levels up, there's a corresponding drop in dopamine levels. Hence, maybe why many times folks using SSRIs wind up with other types of neurologic disorders. SSRIs can also induce hypomania. In other words, folks that are very low, they become not so much just that they're not depressed anymore, but they have low overall functionality. There's also an aspect known as flatlining. There's a flatlining in many individuals that are using these medications, these SSRIs, serotonin reuptake inhibitors. Some studies indicate, this is not conclusive, so I don't want you to take this to the bank, but there's some literature that obviously associates, believe it or not, the use of SSRIs, serotonin selective reuptake inhibitors, with increasing rates of suicide. Now, the argument was, well, folks that are using those medications are more prone to suicide anyway because of depression, so how could you say that? But there is literature that even in under 18-year-olds, the use of Paxil, as an example, paroxetine, is associated with an increased suicidal types of behavior. Emotional blunting is always one that I've seen for years working with folks. They feel flatlined. They don't experience the highs anymore. They don't experience the lows. There's a real flatlining that is seen. There are actually issues with withdrawal, even though it's a non-addictive area. Overstimulation, agitation with many folks. Journal of Clinical Psychiatry showed that up to 25% of the folks on selective serotonin reuptake inhibitors exhibited a restlessness. Double-blind studies prove a link between akathisia and suicide, this overstimulation. So folks, there's Dr. Lane, Roger Lane, noted and documented the relationship between serotogenic drugs that are raising the serotonin and drops in dopamine. So there are, and I don't want this to be a dissertation on pharmaceuticals and pharmacology and treating depression. That's really not what this is about. I want this to be more background noise so that you understand that depression ties and links many times to anxiety. It also ties back to adrenal stress. My adrenals are overwhelmed. They're blown out. A lot of common threads between them. 1 in 5 working women in Canada experience depression or anxiety. Notice how when I said at the beginning of last week's broadcast or the last live stream that we did that there's an overlap, that you see a lot of times depression and anxiety, they don't always function in different compartments, that there's a tremendous amount of overlay. And we're seeing it, and my opinion isn't just my opinion, it's extracted from literature if you're really looking closely at the literature. 1 in 5 working Canadian women experience depression and anxiety, which has caused some women to avoid work, quit work in a study released this was about 7 years ago. It found that 71% of the respondents said that depression and anxiety was a barrier to success, compared to 23% who found pregnancy necessarily a barrier. 3 out of 4 women felt overwhelmed. They felt unmotivated. They were found difficulty in finishing tasks. They found it hard to get to work. 44% started to stay home more and more from work. 1 in 10 women, it's that 1 in 10 women reporting lost her job as a result of anxiety and depression. Now, you say, well, that sounds like to me that that's a result of work and stress. That the depression and the anxiety resulted in them, leaving work. No, I don't believe so. I believe, we go back to what I opened with, that I believe much in the way of what we experience in anxiety and depression is an overall imbalanced system. Bottom line, we're not methylating well because we're missing some key genetic footprints. We are not eating and taking supplementation correctly. Therefore, the cell membranes and uptake and transmission is impaired. There's more inflammation because of a poor diet and a poor supplementation regime or lack of quality in those supplements. There's no physical activity and exercise. I find it hard to believe that a woman that's working full-time, keeping a home, etc., is able to exercise and to be physically active. I really doubt that a man that's working 2 jobs has time to do that. So we have to find balance in our lives. And I'm going to read you out of Ecclesiastes, which I started with the program earlier today in a minute before we go to a break, just to encourage you, but don't misinterpret it. You're going to say, wait a minute, you're talking about here that we're doing too much, and I think we are as a society, but then you're going to tell me that Ecclesiastes said that we should be nimble in our feet, that we should be adaptive, and that we should always be recreating ourselves. There is a fine line. But I think how we manage to do them is to still get adequate rest and sleep, as we have already covered, and then to take care of business in these other areas. You've got to find some time to be active physically. I don't care if it's a 30-minute walk. You can find the time to do that. You've got to place a priority on your diet. If you don't, you're going to suffer. You've got to understand the level of stress and duress that we have. If you don't manage it through some of the vehicles that we already taught you last time, you're going to have the manifestation that we see in that survey on Canadian women that wind up just leaving work, just can't hack it, and we just can't do it. Not only is it too demanding, but when all these other areas become compromised, and there's more. This is the core. There's a huge, huge problem and huge manifestation. So we're going to go to a break here in just a minute. I wanted to just kind of just read you real quickly from Ecclesiastes 11:6. It says, "In the morning sow thy seed, in the evening withhold not thine hand, for thou knowest not whether shall prosper, or which one shall work out successfully. For thou knowest not which one will, this one or that one, whether they shall both prosper in essence, or one or the other will." I believe that what we're learning from this is that, first of all, work is important, and work sustains us. Work sustains our families. It allows you, what I do here, it allows me to pay bills and allows me to be able to continue to pay employees, and it allows me to continue to communicate and hopefully educate and help you. Work and the ability to work sustains your families. It provides for your family. It provides for you. But here's the key. I think boundaries have to be set. We're overriding these boundaries. There needs to be downtime. Chuck Swindoll just the other day just did a great little teaching on leisure. We need to have some times where we do nothing. Walk our dog. Go for a walk in the park. Have some quiet time with your spouse or your significant other, your fiance, whatever it is. We need to have quiet times. We need to have times where you work out and you do things where you're separate and you're alone from others. We need to have times where we're doing nothing but praising and worshiping Him. Why? Because that's where your strength comes from. That's where your peace comes from. That's how you begin to deal with the stress response. When it's all on you, there's a huge, huge problem. But here's what I believe Ecclesiastes teaches us. It teaches us to diversify. That we should diversify ourselves with balance. That we should have a level of preparedness. What I do, I should always be looking to expand my knowledge, to improve the message that I bring to you, to gain more insights, both biblically and from Him, and also in a horizontal manner and fashion what I can obtain in worldly knowledge regarding your health and so on. So why? Preparedness to help you develop multiple opportunities. We should be always looking to create firm footing, that we should have a preparedness, and that might mean, hey, maybe another business venture. It might be expanding your skills. Protection from laziness is what I also believe comes out of this, and it helps us to be productive. We're not called to be lazy. We're not called to be unproductive. We're called to be productive, and we are also called to be, I would say here, providers. We're to be providers for our home. If we don't, I mean, it's unbiblical. I believe, unfortunately, many in our countries today are not. But remember, in balance. We don't want you to go over to this extreme end. I believe you can find the balance. Adequate sleep, adequate rest, exercise. We come back from this break. We're going to wrap this up and get into this specific aspect. So listen to the next little video for a few minutes. I'm going to take a breather. I'll be right back. All right, we're going to wrap this up. Depression, anxiety, and I'm going to leave the anxiety portion up there because of the many crossovers. But we're going to go to some questions first. Forgot about that. We're going to answer some questions first. If someone is trying to get rid of, and when you're trying to multitask here, this is tough. If someone is trying to get rid of yeast overgrowth, Candida, is there a medication necessary like diflucan, or can you do it naturally? Diflucan, fluconazole actually can be used. Usually it's very, very effective. Can you do it naturally? I would always try to do it naturally. Candicid forte is a prep that we use. I'd use one of those 3 times a day. I would couple that with Flora 400, maybe 1 or 2 twice a day. I would not go on a full-blown anti-yeast or anti-candida diet, but you should really watch sugars, added sugars, white refined flours, plenty of vegetables, fruits that are not real high in sugars, like reduce the amount of pineapple or maybe bananas that you consume. I believe other fruits are on the table. Many folks get very extreme, but a lot of vegetables, lots of soluble fiber. I would actually even do a buffered C ascorbate flush. We have buffered C powders. We have on our website how to do a C flush, and I recommend that you do a C flush. Get started on Candicid Forte, Flora 400s as well. Hello, I have 2 questions, different friends. My friend was diagnosed with Crohn's. Medication is $80 a month. She'd like to go a natural direction. Are there natural remedies for this? If there is, I'd like to make an appointment. Well, you can certainly make an appointment. I don't know that I want to get into the $80 a month because you might be doing some supplements that cost more than $80 a month. So I don't know, is that really the issue? I don't know if that's the issue. The issue is doing the medications that are suppressing the immune system. Let's redirect our focus. You're taking meds. Don't see them as some inanimate objects. They're impacting your body. If you're using 6-mercaptopurine, that has technically immune suppressing types of activities. Years and years ago, was used as a chemotherapeutic agent. You might be using methotrexate. Methotrexate, originally a folate antagonist, was originally used as a chemotherapeutic agent. Now it's technically being used for Crohn's and for psoriatic arthritises, etc., for inflammatory autoimmune types of conditions. It's an immune it's an immune suppressant. Lymphoma risks are higher with methotrexate, or you could be using an injectable DMARD drug. Huge immunosuppressive activity. So is it about the $80 a month, or is it about I should try to get to the root of the matter and try to do something that is more healthful to my body? That's what I believe. Is there opportunities here? Absolutely. It's going to take work. An elimination diet. I probably would put you on a type of a meal replacement, all cooked vegetables, lean protein for at least 4 to 6 weeks, virtually nothing raw. Do an elimination portion, get you off dairy and wheat big time. Do massive amounts of probiotics, massive amounts of omegas, curcumin, good forms of turmeric. So I can guarantee you, unfortunately, it'll exceed $80, but what are you after here is what my question really is. Next question is from Jim. Son Josiah is 19, has gluten problems. Yes, Josiah, it's a great name. I love that name. So he has been in the ER 5 times in 2 weeks. Good Lord. He has been getting several tests, but the medical doctor doesn't seem to know what to do with him. Is there something you can do ASAP to stop the vomiting? I don't think there's anything I can do to just stop the vomiting. If medications like Zofran ondansetron is not working, or prochlorperazine, I really don't think there's something I'm going to do that's going to remediate that. What I would really be after here, what has he done from a gluten standpoint? Do they truly know how to do and reduce a gluten linked dietary aspect? So that's a lot tougher. He is on a gluten-free diet, Josiah's pointing out to me. Why he's still having vomiting, I'm not real sure. There has to be, because if he's truly on a gluten-free diet, there should be some other aspects that are coming to line. We may need to do some specific forms of digestive enzymes with him that could be helpful. So hopefully, if you have any more questions, support at askjoedimatteo.com. As I mentioned earlier, for many of you viewing this live stream, it's not an issue for you. You're comfortable with your computer, or you do this type of scenario, you're very comfortable. For maybe someone that's not as comfortable with a computer, maybe a parent, maybe someone else doesn't even really have a computer, I don't know. We're going to be putting together some DVDs of these teachings, these live streams, so it'll be easier. You'll be able to pop them right into your, however you do it, your cassette, or at home, or in a boom box, which I do a lot of times at home when I listen to some teaching. So certainly we're going to make them available for you, so I hope that blesses you as well. Live streaming, a lot of past ones. Go back and view the archives. Turn some of your friends on to them as well. All right, let's get into this. How do we battle this? How do we deal with depression and anxiety more holistically, more integratively? We went over the downsides of medications. We went over many of the links, how anxiety is linked to an overwhelmed adrenal system, how it imbalances. Now let's get right down to the brass tacks. Methylation pathways. What does that mean? As I lose my voice here. Methylation means we need to be able to donate certain chemical structures in our body to certain pathways metabolically within our cells in the mitochondria. When I don't methylate well, I do not detoxify well. I don't clean up debris well. And certain pathways for energy production and metabolic activity are greatly interrupted. I'm trying to keep this as straightforward as possible. So methyl donating groups are going to be things like B12, folic acid, methionine, betaine. So I got to take all these supplements. No. If you have depression and anxiety, we need to run a test called an MTHF, to see whether or not you have an inborn error of metabolism, which leads to a lot of different mental disorders. So let me just quickly. Journal of Neuropsychobiology, 2014. This is brand new. Increased levels of homocysteine are observed. That's a result of having this problem here, by the way, in various psychiatric disorders, amongst them schizophrenia, depression, bipolar disorder. The polymorphism known as methylene tetrahydrofolate reductase results in association with both bipolar disorder was found in certain polymorphisms. I'm going to keep this simple. MTHFR, genetic variations, major depressive disorders, American Journal of Genetics and Neuropsychiatric. Yikes. I mean, you need a whole book just to be able to get that label on the front cover. MTHFR, genetic variation, has been associated with a diagnosis of major depressive disorders. Repeated measurements of the analysis show a variance and severity trajectories with what's called the C677T. So you don't need to know that. You just need to know that there's a link, an inborn error of metabolism, that if you happen to have it and you could evaluate it with a simple blood lab, that it could be leading to your anxiety disorders and especially your depressive disorders, amongst other things. We're not going to talk about that today. Our results suggest that MTHFR 677T polymorphisms serve as a marker for major depressive disorder prognosis. We need to do independent replication. Repeat it. I believe it's there. One last one, Journal of Affective Disorders, 2014. I'm going to go right to the conclusion. Individuals with a genotype CMPT, MTHFR, have the probability of suffering from major depressive disorders. So, if you have anxiety, depressive disorders, we need to evaluate that. What can you do about it? Well, I have one here. MTHF, 5-methyl tetrahydrofolate, 5 milligrams. It's a specific form of folic acid. Mood Essentials. Why does Mood Essentials work? Because of the methionine component to this. which helps methylation pathways. It helps you to produce SAMe, makes neurotransmitters work in the brain. Great, great. Mood Essentials, great for mood disorders. Wonderful prep. Let's bump down cell membranes. We're going to run out of time. I already taught you that when I have poor cell membrane, the outer layer of your cells have a lipid layer. It's a fatty membrane layer. If it is impaired, I don't know how else to say that. If I've got too many bad fats coming in here, rancid fats, as opposed to good fats, fish oils, omegas, nuts, and seeds, you begin to impair this neuronal capacity. You have signal transformation problems. 1999, Archives of General Psychiatry showed that mega doses, I can't even read this because there's too much here, of omega-3 fatty acids actually inhibit certain neuronal transduction pathways similar to pharmaceuticals like lithium carbonate and valproate, which are used as balancers to mood disorders, bipolar disorders, and have stabilizing effects. Conclusion, omega-3 fatty acids are well tolerated, improve short-term course of illness in a preliminary study of patients with bipolar disorder. If you have bipolar disorder or any form of depressive disorder, if you are not using the right forms, the triglyceride molecularly distilled form of omega-3 fatty acids, you're making a huge mistake. If you don't like swallowing capsules, we now have a concentrate, a liquid concentrate, 2,800 milligrams, not of fish oil, of active ingredients. You see that 800? That's not fish oil. That's omega-3 fatty acids, EPA, DHA. Don't be deceived by a lot of this. Oh, I have 1,500 milligrams of fish. Active ingredient is what you're after. What does it do? It changes the cell membrane. It allows for uptake, more enhanced transmission, makes these brain transmitters work. Inflammation. Depression is correlated. I already read that study too. I don't want to go back. Inflammation, bad diet, processed foods, refined foods, bad fats, chemicals in foods, a lot of preservatives, colors and dyes. All of these components absolutely affect the inflammatory pathways. The more inflammation you produce, the higher the rates of depression and anxiety and major depressive disorders, bipolar disorders, which you just saw. Jump down to poor diet. Depressive symptoms correlate with diet. A study published in December of 2012, Centers for Disease Control showed that antioxidants from fruits, vegetables were lower in individuals with late life depression. Folks didn't consume foods such as peppers and pumpkin and squash and etc. It goes on and on. Their depression was higher. The less vegetables, the less fruit they consume, greater levels of depressive disorders. You think the diet. This is only one. I got stacks of these. British teenagers. They're saying here that depression in adolescence linked to obesity and even anorexia and suicidal behavior and antisocial behavior. And saying, wow, though, Cambridge University scientist Diana Bamber just comes out with this study that says that the severe depression that is seen in many young children goes hand in hand with self-harm, eating disorders, basically poor diet. Many of the thousands, she said, many other thousands are less seriously affected with mood disorders, irritability, changing sleep patterns. Has a lot to do with their diet. Several trials have successfully used omega-3 fatty acids to relieve the symptoms of depression. Levels of folic acid need to be considered, the right forms, by the way, MTHFR, selenomethionine, zinc, and thiamine. These are also found to be linked to depression and have benefited patients that have utilized them. 200 young offenders with anxiety disorders, antisocial behavior. Some of these young people were violent. 200 of them. They put them on mega doses of fish oils, multiple vitamins, significant reduction in their antisocial and aggressive behaviors. Folks, I will tell you, diet, inflammation, improving cell membrane. I know this sounds like a long way to go about this, but it's the effective way. Elimination of caffeine and sugar should be done for at least 2 weeks in folks that have depression. Reintroduction in a blinded fashion can be used and indicate depression. What they did here was they pulled folks off refined carbs and sugars and caffeine with depression for 2 weeks, and they found their depression. And they say, wait a minute, you need 2 or 3 months. I agree. But just in 2 weeks, there was an improvement in their symptoms. It was across the board. Another one from behavioral therapy and treatment in 1990 says the same thing. Let's bump down. So diet plays a role, inflammation plays a role, exercise or the lack thereof. This is from the Archives of Internal Medicine. Exercise reduces depressive symptoms amongst patients with chronic illness. Patients with depressive symptoms indicative of mild to moderate depression for whom exercise training improves function-related outcomes achieve the largest antidepressant effects. What's that telling us? When you're physically active, even up to moderate forms of depression, you get physically active, you have literally antidepressant activities as you would from the world of pharmacology and pharmaceuticals. Exercise on par with drugs for depression. Another extensive article, I can't even go into it, 200 individuals. They put them into 3 different groups, exercise, more aggressive, no exercise, etc. Very clear. The study published showed that in individuals, women 40 years of age and older with major depression, the more they exercised, the more they worked out. It worked as well as sertraline or Zoloft, the pharmaceutical for depression. By the end of the study, they found that 47% of the patients on antidepressants no longer met the criteria for major depression. And that was true of 45% in the exercise group. Here's what they did. Major depression puts you on drugs. Major depression, focused exercise and activity. Whatever this was, 12 weeks. They find 47% responded to the meds, 45% of the other group responded to exercise. The exercise worked as well as the meds. Hence the article says exercise on par with drugs for aiding depression. I have so much here, it's crazy, and I don't even want to go into it anymore because I don't normally like to read to you when I'm doing this. But I have those pretty much pigeonholed into memory, the generic themes, but I wanted you to hear where they were found. If you're battling depression, I have got to change your diet. Now, there could be even some food allergies and so on that have to be defined. But basically, the bottom line is, I need to change your diet. I need to get you to a whole foods, lean proteins, plant-based, lots of nuts and seeds, quality types of fish oils, etc. This has to change. If you suffer from anxiety and depression, I've got to get you exercising. The lack thereof drives you further into the abyss. You just heard how it helps to pull you out of the abyss, as well as pharmaceuticals do if I get you doing this regularly. We already talked about stress in the past live stream. You need to go back and view that. And eventually, I will tell you there's a lot of detail that we could work with, but that we could work with you in evaluating neurotransmitters, urinary neurotransmitter testing, if you suffer from anxiety and depression and even sleep disorders. We can do adrenal stress indexes. We certainly can evaluate male and female hormones that play a role. And eventually, even I would even say in folks that have major issues, do some food sensitivity testing. Some folks need to go through a detox pathway. They need to have MTHFR levels done. They need to have 25 OHD levels, low vitamin D status associated with depression. We need to get a B12 level. Folks, like I said, this is not completely comprehensive, but the first broadcast, we show you that how an overwhelmed stress response adrenal system leads to these two. The next step was to bridge it over to anxiety. What are some nutrients you can use? This third step ties them all together. Depression, anxiety, stemming from an overwhelmed adrenal response, but then also defines some metabolic things that could be going on, cellular level issues going on, inflammation in the body that we've got to turn around with nutrients, change your diet, get you moving physically in activity, got to manage your stress. You've got to read the Word. You've got to be reading some Psalms. You've got to be reading some Proverbs. You've got to be worshiping and praising. You need to be listening to some praise CDs. You need to be engaged. And then we need to evaluate neurotransmitters, maybe cortisol levels, 25-OHD levels, B12 levels. There's more. I don't want to make this more complicated. And food allergy testing. Folks, I hope we covered it. But let's say right now you say, well, I've got some mild issues. What should I do? Well, you start here, the diet. You've got to get physically active. If you're not sleeping, I've got to get you sleeping. Let's get you on some essential sleep if you're not sleeping. Why? Because you repair and you clean up toxic metabolites in the brain. But in the interim, you got to be on like some quality omega oils, not some bargain basement brand. Let's get you on some mood essentials. If we don't know, you haven't had a lab done, you can use one. I use one a day anyway. You can use one of these 5-MTHFs on a daily basis. We can start with something simple like a L5-HTP. It's at bedtime. Do you realize that quality forms, we have a German standard Commission E extract, a German manufactured prep, St. John's wort. We only use European herbs, okay? The right forms, and these are very inexpensive. You got to get to the right dose and have the right form. Do you realize that these are documented in the literature, quality forms of St. John's, to have serotonin and norepinephrine and actually maybe even some dopamine activity in the brain and a balancing component? So you have tools, omegas, mood essentials, maybe some quality forms of St. John's, some adrenal essentials to help you battle the adrenal cascade and the stress response. If we need to work with you individually, we can. You need to call the off-air number 888-865-9595. You say, wait a minute, but you're not a psychiatrist. Well, I mean, you can be doing your meds. You can still see your psychiatrist. You need to start looking at roots. Well, I'm in counseling. Praise God. You should stay in counseling. But you still can't overlook this. Well, I'm on major medication. Should I just stop them and do this? No. You need to do this. Right? We need to engage this, then speak to your physician about what you're doing, how you're responding, and then start looking at a gradual attempt at a weaning. Don't just do this on your own. But here's the key. You can't do one at the expense of the other. I don't believe it can be all counseling. That's important. You've got some spiritual issues. You've got some heart issues. You need to deal with that, you and God. If you have some metabolic and some cellular and some functional things going on, we need to cope with that. Maybe you might still need some medication, but the whole goal should be, can we get you to reduce the amount of medications that you use? I would certainly hope that you've enjoyed this live stream on depression/anxiety, tripped by a lot of different mechanisms. Let me read to you Ecclesiastes 12. We went over this on the broadcast earlier today. By the way, we broadcast live stream once a week, our radio show as well. Let us hear the conclusion of the whole matter out of Ecclesiastes. Fear God, keep His commandments, for this is the whole duty of man. Let us hear the conclusion or the end of the matter. Now, what was he saying here? Well, bottom line is Solomon sought all the pleasures of life, went through life, tried to figure out everything, had all this wisdom. God gives him wisdom that no man has ever had. He has wealth that no man's ever had. His life goes off into all kind of different directions, and he's really trying to really seek the meaning of life. Right? And he finally distills it down after 12 chapters of literally ranting and roaming. And he says, I've sought pleasure, personal fulfillment, you name it. I've accumulated, I've done, I am knowledgeable, full of wisdom. But he says, what's the ultimate meaning of life? What's it come down to? And I believe he sums it up. Fear God, keep His commandments. I need to fear God and keep His commandments. You need to fear God and keep His commandments. And when I just made some notes, directing our lives outward to others, what the Great Commission was, what Jesus told us to do. That we're to involve ourselves in others' lives. That we're to meet the needs of the others. That we're to mentor. That we're to give time, effort, love, finances, whatever it takes. But we are ultimately to be in a position to serve others, to act as servants. Truly then, we fulfill the Great Commission, and at the end, the great conclusion, the issues of life, fear God, keep His commandments, for this is the whole duty of man. God bless you. Thanks for being with us. So much appreciate you tuning in. Make sure you turn on some of your friends, maybe your family members, live stream, future coming, some DVDs or CDs or whatever we're doing with these things. I have no idea, that you can view them or listen to them. I hope you're blessed. Send us some emails if you have some suggestions of other ones you'd want us to do. And I hope you have a great rest of your day. God bless you. Thanks for being with us.